Welcome to Community Forum. My name is John Guglieltino. I'm your host. This evening we're going to be talking about an old friend of mine, the Hispanic Center of Greater Danbury. With me this evening is the Executive Director, Ingrid DiMarzio, and she's the Executive Director since last April. So we're doing like a little report card as to how she's doing. Welcome on the show once again.
Thank you for having me.
Yeah, you're welcome. Could you, before we get into some questions we have, can you tell us a little bit about your background and how you came to your, how you came to this position you have now as the Executive Director of the Hispanic Center?
Sure. Back in September of 2008, I joined the Hispanic Center team as their Director of Resource Development and their grant writer, and spent my time building financial relationships, community relationships, and then the position became available last April. And I assumed the executive directorship, and it's been a year and some months later, and here I am.
What I meant to say is where you went to school and a little bit about yourself.
Okay.
Also.
I'm a Columbia graduate, originally from New York City. I hold a master's degree in public policy, and in 1994 entered the world of nonprofit, and haven't left. I've worked with different types of organizations all within the nonprofit realm, the National Institute for People with Disabilities, the Multiple Sclerosis Society in New York City, as well as part of the Department of Employment Workforce Welfare to Work Initiative in New York. Moved to Connecticut about 6 years ago.
Oh, okay, so you've been in Connecticut and in the general area for that time frame.
Yes.
Okay.
Yep.
All right, and let's start off this way and say, what's new? What are some of the changes that have happened in the past year? There's been a lot of things going on at the Hispanic Center, but can you say things are improved, grant-wise and funding-wise for the Hispanic Center? Things are tough in general in the entire realm of nonprofit because of cuts in the government, whether it be at the federal level or the state level. But would you say that things are improving? You're shaking your head.
Absolutely, absolutely.
Okay.
I think that within the last 18 months, the Hispanic Center has been very, very fortunate. Both with its state funding, we hold a subcontract agreement with the Community Action Committee of Danbury. It's a DSS contract to provide social services. We provide them in Spanish. And several months ago, that was on the chopping block when our state was trying to pass its budget. Unfortunately, our funding stayed intact, especially at a point in time in our economy where there are a lot of people that are in need of services that weren't before. And that's, your working family, and we've been able to sustain our service levels and not lose any of our funding on the state level. We've also been very fortunate that we hold very strong relationships and collaborations with the corporate sector. Connecticut Light and Power most recently refunded our acculturation program, which are ESL classes and technology and citizenship classes. Especially now when people may find themselves unemployed, it provides them an opportunity as they're seeking employment to better their skills, to both their language skills, their technology skills, and that's important, especially when there's so many people competing in the job market right now.
I realize I didn't ask you what the main mission of the Hispanic Center is and some of the things you do.
Yeah.
So
well, the Hispanic Center, as you know, it's been around since 1967, and its mission is to fully support Spanish-speaking populations in the greater Danbury area and in the city of Danbury in obtaining and sustaining self-sufficiency, thereby creating a better community, a healthier community. We focus a lot of our work also on preventive health initiatives in the community. And that translates into our technology and acculturation programs, which incorporate our civic engagement, our citizenship. It includes our work with the Department of Social Services and our local CAP agency, which is CACD, and maintaining, ensuring that people are healthy, have access to their basic needs. It has also, most recently with the Census 2010, we became a partner with them, an account site. Danbury had 3 very specific special tracts that they were trying to measure, and we were very instrumental in being able to get out. The community trusts who we are. They opened the doors to us, and we were able to get that information to the census, which is crucial to making decisions as to how resources, money, is divvied up in communities.
How are you, let's say, more effective? Because you sometimes hear that. As you know, I belong to a number of groups and constantly circling around, and you hear on one side of town you hear something, and you hear something on the north end of town, and you're on the west side of town you hear something else. And it always seems to be along the lines of, well, I don't know what exactly they're doing over there. Couldn't one of the city departments do what they do? And I think one of the unique things that we talked about before we started the show was the fact that the collaboration of all the nonprofits, which a government employee really couldn't do. You've got to be out there in the trenches working with the others and knowing what the others are doing. And what I'm referring to is like the Salvation Army, that they have this function, but the Hispanic Center carries it forward. They're only keyed in on somebody's thrown out of the house or has a problem. Let's say they're splitting up or whatever, the husband's a wife beater or whatever. They go there, they may get a temporary rent, but now what do they do? The Hispanic Center would step in if, let's say, the person's Puerto Rican or whatever, and provide some services there, where, let's say, the community action might do field services, right, and things like that. Can you give a couple examples, maybe?
I'll give you, and one of the first examples that comes to my mind is a collaboration that we have going on with the Women's Center. Domestic violence is a big issue in our community, and what happens is that typically when a person or a woman who's ready and finds that strength to walk in the door and tell us her story and ask for that help. Typically in the past it would mean the Hispanic Center making a referral to the Women's Center or calling up and then asking that same person to gather that same strength again and go someplace else and regurgitate that story, which is a tough thing. And in working with the Women's Center, what we've done is that they have a bilingual counselor there who now spends once a week at our site. And so she is a representative.
So there's one intake.
Yes. Yeah. And so what happens is that when those cases come in through our doors, we schedule them and we funnel them around the time that person with that expertise in the domestic violence arena is at our center. We lend the linguistic, the cultural sensitivity support, and what you have now is a team of people from 2 agencies really looking at someone and comprehensively coordinating services to get them out of the situation that they're in, stabilize them, and ultimately allow that person to be back in society and be able to function. And I think that's a perfect example of how agencies can partner and not duplicate services. One of the things that every person brings, or every leader brings their own energy to their position. I am a big supporter, always have been, of collaboration. It is not consolidation. It is not, merging. It is really working with other community partners and having everyone understand what their level or what their expertise is and what skill and strength everybody brings to the table, and building on those and really creating a comprehensive system. And it's why I love where we are in West Street. That's truly Nonprofit Row. I've got the United Way to my left. I've got Danbury Youth Services to my right, the Women's Center on the corner, Danbury City Center, and it really facilitates communication, collaboration, and effective service coordination, which is the best that we can do for our community.
And if you had government workers do all that, you probably, instead of 3 people, you'd have 7 or 8 people.
And then what happens is that then everybody within the nonprofit and the social social service sector really recognizes what each partner's strength is and builds on that. And so instead of having that type of, or often what you find in with many small nonprofits, or during a time when nonprofits are struggling for funding because funding is very tight right now, you need that support because you can't do it all by yourself. I am not the domestic violence expert. My center does not hold an expertise, but we sure do have many clients that walk in through my door that because I can speak Spanish, because there's a trust factor there, because they're not afraid to walk in through my door, I can access those services and link them up to those professionals. And it's the same, the same relationship. The nature of that relationship also exists for CACD. When someone who may walk through CACD's door, not being able to communicate, needing, let's say, access to the fuel program and access to heat in the winter, and at that point in time, there may not be someone to serve them because there's a language barrier. Instead of picking up the phone and sending the person back down to me, that person can come in. We share actual case management tracking software now. So I could see what the client received at CACD. CACD could see what we did for the client, and so we're building on that. And again, it goes back to comprehensive service coordination, ultimately to do it as effective, as cost-effective as possible, as time-effective as possible, and the ultimate goal is really to coordinate the services so that someone can get back to work, back into the community, functional, with having some of these issues resolved, without stepping on, duplicating services, without, it's very difficult to do that when you don't talk to one another.
Right. So that's great. Mm-hmm. And so how far has this gone? Is it just right now between CACD, the Women's Center, and the Hispanic Center?
No.
Or are you doing it with most of the agencies?
I do it with all the agencies. And if I haven't knocked on someone's door yet, it's because I haven't gotten there yet and I'm about to knock. And it's just really part of our vision, our strategic plan. It's really the commitment that the Board of Directors of the Hispanic Center and myself and staff have made. It's really it's a belief in collaboration. So one of the most recent ones is a possible collaboration with Ann's Place, the home of Yes I Can, for people who have been diagnosed with cancer. In my community, in my culture, cancer is treated as a death sentence. The moment you find out that someone, a loved one, has cancer, you are already mourning. And there are treatments available, and there are services, and there are professionals in that area that can help a family work through that. Not just the person who's afflicted with the cancer, but the children in the home and the extended family as well. And it's an education process that we're engaging the Hispanic community, and Ann's Place has opened up its doors in educating us as to what they do and how we can partner with them in translating that so that it is effective in the Latino community. You know, things like this prostate cancer could be treatable. But again, there's this misnomer.
There's this fear of going to the doctor. Well, if you're afraid of going to the doctor, it's going to be too late by the time you actually go to somebody.
Absolutely.
You know, it hurts. Mm-hmm. Oh, well, now you're going. Well, it might be right. It may be too late.
So we spend a lot of time doing a lot of health education and prevention work because, as you know, in the Latino community, one of the things...
Do you want to segue into what you got coming up in the community-wide health expo?
Yeah. Every year, the Hispanic Center has sponsored an annual health fair. Well, this year it's not a fair, it's a health expo. Again, very fortunate in our collaborations to have a platinum sponsor this year, and that's Boehringer Ingelheim, a large corporate presence in the greater Danbury area. The Camino a la Salud, which translates to Pathway to Healthy Lifestyle, is really a call, a challenge. We're challenging the city of Danbury to become active, to learn about how you can prevent diabetes, obesity, cardiovascular disease, prostate, and breast cancer.
Now,
And in the case...
now this is open to anybody,
It's
right?
community-wide. These are things that affect us. It crosses socioeconomic status, race, religion. You know, we have a huge epidemic in this country, and that's obesity. And that leads to diabetes. Diabetes leads to heart disease, stroke, vision problems. And, you know, when you look at statistics in this nation, you know, we're raising a generation who may not, you know, outlive their parents, you know, or the previous generation, and that speaks volumes, and it starts with education and prevention. And BI, Boehringer Ingelheim, has partnered with us in being able to bring this message out to the entire community, because although we speak Spanish, and we are the Hispanic Center of Greater Danbury, we serve absolutely everybody who walks in through the doors. You don't need to speak Spanish. We actually have volunteers who speak Portuguese, and we will do everything that we can to be able to communicate you, whether that be in Chinese or whatever it is. At the end of the day, if you're walking in, we're a social service agency, and that means the community.
Because this health need is across the board here.
It's everybody.
Yeah, and especially with the middle class not being so middle anymore, you know, the downward mobility with this economic downturn, they need to get help wherever they can get it. You know,
absolutely. And back to your statement where people wait till they get sick, sometimes it's a matter of not having access to comprehensive health care. And so if you're uninsured or underinsured, and that doesn't mean that you're unemployed. You know, there are many Americans that work in this nation, but don't have health benefits.
They're working 40 hours, 60 hours, and they don't have health care.
So what happens is that, you know, things get worse before you actually seek help, and that typically means a visit to an emergency room. And in minimizing that, and in talking to people about nutrition, and some of the triggers for some of these preventable diseases, and how to recognize what those signs are, and what to do when they're experiencing that is truly important, as well as linking them in this health fair is just that. We have approximately 40 community service agencies participating. A lot of them are health service providers in the area. We have a federally funded community-based health center in the city. You know, we have the AmeriCares Free Clinic in the city. Danbury Hospital is an amazing neighbor with many of their clinics and their services and free services when it comes to breast mammograms and breast cancer services. And so they'll also have access to every other service provider that we can link them to in being able to access points of health care. As well as some fun things for the kids. Because we're targeting them. The earlier you target them, the sooner this information, you know, they hear it over and over and over again, hopefully will lead to making better choices.
Do you have a website where this community-wide expo is explained a little better?
They could visit the Hispanic Center of Danbury.org, and as of next week, the Hispanic Center is officially launching its social networking site on Facebook, and so I'm pretty excited about that. Okay. We've got participation. I'm very proud of the participation we have at the center from youth volunteers. They're almost our evangelists out in the youth community, and with their volunteer work with us and in understanding what we do and why we do it, it just makes our reach go even further. And what youth do you know that doesn't Twitter or Facebook or text, and being able to be part of that will facilitate getting this message out. So I look forward to inviting you and everybody in our network to join us on Facebook. Okay. And there will be a page specific to the health fair, how to participate, because this year it's a little different. This year we also have a 5K race attached to the health fair.
Okay. So if you get checked out that you're healthy enough, then you jump in the race. The 5K race will serve as a fundraiser to help offset not just the cost of the annual health expo that we're going to do at Rogers Park on August 14th, but to also sustain our health education and prevention work. It's a tough funding time, as I said, and so agencies have to get very active and very creative in how they sustain their services. When does this start? on
Well,
that day?
as of next week, there's the launching of the Facebook page. All of the information already exists on the Hispanic Center website, and all of the posters and marketing materials for the event hit the community this week.
Okay, and what's the start time, I mean, on that day?
The race starts at 9 a.m.
All right, so
it is at Rogers
people
Park.
should get there 8:30 or 8 o'clock.
Yes, they need to register for the race before in order to participate, and they can do that online, on Facebook. They can pick up a brochure at the Hispanic Center at 87 West Street. They can email me, hispaniced@snet.net.
And their telephone number?
Yep, 203-798-2855, as well as the race goes from 9 to 10. After the 5K race, then we kick off the afternoon's event with the health fair. And again, Boehringer Ingelheim is a platinum sponsor. It'll be a beautiful health fair under tents, and there will be activities for children and for the whole family, for the entire family. So it'll be a fun. So that goes from 11 to 4 p.m. at Rogers Park on August 14th.
Okay.
So I invite everybody to come out.
Very good. Now, to change gears a little bit, you've got something tied in with the school.
Yeah.
You've been doing a lot of things with the school. We mentioned the fact that you do language training.
Yes.
You know, you coordinate. You know, you don't necessarily do all of it still at the building, but you're coordinating with the other agencies. And in conjunction with that, you're getting into what?
Well, we're also simultaneously, as we're working on our 5K health fair, simultaneously also kicking off our annual. This is our second year doing an annual back to school backpack drive. And our sponsor for that is the Pepsi Bottling Group out in Cantona, New York. So we have, local neighbors, and we have not so local neighbors. That's a company who supports its community and its employee community. Is also made up of Connecticut residents due to the nature of how close New York and some parts of Connecticut are. And last year we were able to provide about 90 kids with all of their back-to-school supplies and a brand new backpack. This doesn't duplicate the Business Volunteer Center of Danbury's backpack drive, because we do it in coordination with that as well. But what it does is it provides additional kids access. So where typically in the past with the Volunteer Center we could do 15, 20 kids, last year we were able to do 90. Which is a great thing, and there's nothing better to motivate a child to going back to school and doing well than with a brand new backpack, brand new pencils.
And it's necessary for their health to have the right backpack.
It is.
And not try to carry them in their arms, or because they harm themselves.
Yeah. And what the backpack event does, and this year it's going to happen on August 28th at St. James Episcopal Church on West Street, one of our neighbors who we collaborate with. What's going to happen is that just like last year, we've reached out to Dr. Pasquarella, Superintendent of Schools, and the Board of Education, and we bring all of the Board of Ed representatives, people from Pupil Services, Transportation. We were able to fill out the free lunch applications for those kids who are eligible, so that they don't miss the deadline. And what happens is that parents, in addition to receiving their child's backpack, also receive all of the necessary information that they need to get ready for school in September. And we have a simultaneous translator translating everything that the Board of Ed is doing. And so it's a great event for kids and their families. As well as
I was gonna get into something, but go ahead. You want to complete something?
We also sponsor a very special pilot project with collaboration with Connecticut Aspida and the National Volunteer Corps, AmeriCorps, where we have 5 Latino WestCon students who tutor 25 English language learners at Rogers Park.
Wow.
And that's all through volunteer. It has been supported by Union Savings Bank, which is another great neighbor in this community and a partner of the Hispanic Center. And this Saturday, we're having a car wash to fundraise for September so that they have the snacks and the things that they need.
Well, this is not going to go on for a couple of weeks, so you can give the date. You know,
Yeah.
it won't. They won't.
So I mean,
do that,
this,
yeah.
you know, again, it goes back to attesting to how collaboration in the community can lead to such amazing projects, you know, happening.
Okay. What I wanted to get into was you also got some word on a community block grant award to do some improvements to the facility and make it more accessible to the handicapped. You want to talk a little bit about that?
Absolutely. The Hispanic Center is in a unique situation. It's one of the few agencies in the city that actually owns its building and its property.
And that's because someone was generous enough to give you a break.
Absolutely.
And when you got it, yeah.
But with everything, you need to maintain it, and you need to think and be visionary with your space in designing how effective it is to serving and expanding your service provision and who you provide services to. And one thing that the Hispanic Center has not been able to do until this morning was really open its doors and be ADA compliant, the American Disability Act, be compliant with that act, because our buildings are not compliant. And it's a prerequisite for a lot of funding. It's the law, and by becoming compliant, we can now open our doors to serve a whole other pool of the population that don't have access to our services because they physically can't get in the building.
Yeah.
And this morning, we met with the individuals from HUD, and reviewed our contract because we've just been awarded $100,000 to make our building ADA compliant under the City of Danbury's HUD Fiscal Year 36 Community Development Block Grant, which is a huge leap forward.
Congratulations.
So I'm really excited about that.
And then you had other good news from the City of Danbury, the Community Investment Grant.
Yes.
Yeah.
Yes.
Explain that a little bit, having to do with...
Well, every year, the City of Danbury puts out its request for proposals, and it's a competitive process, and agencies get chosen to receive city funds. Our agency has not had City of Danbury Community Investment Fund since 2007, and it's been a great thing to learn that we're receiving city funds again, because it completes, we're getting funded for health education initiatives, which
and
again,
there's a lot of that need.
There's a lot of that need. And what happened this year was that the City of Danbury outsourced or had the United Way and their trained volunteers review the proposals of the agencies competing, and you had representation around that table reviewing proposals from the business community, the social service community, from all walks in Danbury.
So they reviewed the application?
They did, and they awarded the Hispanic Center funding for our health initiative. And it's a great honor because it's the agencies and my peers recognizing the value of the health education and prevention work that we do in the community.
One more time, they're waving goodbye to me. Your website.
It's www.hispaniccenterofdanbury.org.
And your telephone number.
And our number is 203-798-2855.
Thank you for coming on the show.
Thank you very much for having me.
And thanks for tuning in to Community Forum this evening. Good night for now, and we'll see you next week.